Hi, I'm Mayur Vibhuti. I'm a GP from Medway in Kent. I'm also a digital clinical lead for NHS Kent and Medway ICB. Right, so I just wanted to talk to people about innovation and digital transformation and actually about how we train people to do that, because that inevitably innovation happens on the ground with frontline people who are closest to the problems that we see. Obviously, after the COVID pandemic, we moved a lot of stuff to virtual and digital consultations, virtual consultations, online consultations, and so practices started running with this kind of stuff without really having the time to think about how things should be deployed, what is the best tool for the right job for consulting with patients or triaging patients. So what we wanted to do in Kent and Medway and through the Primary Care Training Hub is create a digital transformation program for specifically primary care. And this was multi-professional in nature. So we had people who were PCN managers, GPs who were interested in digital, practice managers, but it actually was open to anyone working in primary care. And this was an 8-month program. And they would come once a month out to one of our local universities and deliver a kind of a part hybrid, part face-to-face program, as this was through the COVID pandemic winter of 21-22. And what we wanted to do was facilitate people learning with different lenses across professions. So practice managers sitting down with GPs, sitting down with PCN managers and talking through some of the issues that they're dealing with and trying to train them up so they could have more kind of 21st century leadership skills rather than the old school kind of command and control that we're all used to in the NHS. So there were 3 pillars that we built this program on, one of which was leadership, one was digital innovation, and one was quality improvement. And so from the slide there you can see that we feel this is where transformation happens. What do we want to do? We wanted to provide some knowledge, so there's some knowledge giving, and then also some practical skills, because we wanted this to be a really practical program to deliver collaborative work-based projects as an outcome of the program as well. So by the end of that 1 year, they had to deliver a project, and it couldn't be a project just for themselves or their practice, it had to be across some organisational boundaries. So what happened was that they were able to learn some skills and then actually deploy them to create a project of their own choosing and present it to our ICB primary care team. And in that way they could pitch projects that could potentially have future funding and for sustainability. So our learning outcomes were really around understanding leadership trends for the 21st century. So this is things like new power, transparency, flattening hierarchies, creative spaces, improving digital literacy. So we had some of our suppliers, such as Apex and Ardens, to come and do talks and webinars about how to use their products most successfully. And so we could spread the knowledge about how to use these tools. We also specifically talked about creativity and creative thinking and innovation to think and do differently. And so we often are very good at process and starting a project from start to finish, but we often don't take the time in primary care to just sit around with an open agenda and talk about how we could do things differently. We also brought in a speaker around human-centered design, so different ways of approaching problems, so design thinking versus quality improvement, and just really, again, sharing some of these concepts that were completely new to people working in primary care. So really we wanted to empower the delegates with tools and support networks to make a positive difference to patient care across the system. So obviously all of these people worked across Kent and Medway. So by virtue of going on a program for 8 months, they all started talking to each other and networking, and we created a virtual learning environment that they were all part of as well. How do we know that this was any good? We did an independent evaluation by the University of Kent, and the evaluation showed 100% of delegates reporting they had improvement in confidence in leadership, digital innovation and impact in the workplace, and this was measured from the start to the end of the programme. And in the graphic there, you can see that all of the answers were either very good or excellent, which is the blue and the orange. So capabilities to fulfill a leadership position, have the necessary experience to fulfill a leadership position, with the same one, have access to appropriate professional support to fulfill a leadership position, and in my ability to lead multidisciplinary and or cross-sector teams. So I think what this really kind of showed is that there's real willingness to learn about digital, to do innovation, and to work across traditional boundaries, so work across organisations. And some of the projects that came out of this programme were working towards an e-hub and also improving remote monitoring with care homes across a PCN.